So Sophia and I are going to go over chapter 18, but just the bones. So this is going to be chapter 18-1 revised for your viewing enjoyment. So a couple things that I want to clarify. So the musculoskeletal system, it provides movement and it includes your skeleton, your joints, your ligaments, muscles, tendons, and even some accessory structures. Okay. Your bones provide a framework, right, for your body. Muscles help the bones move, and the bones and muscles have to work with the nervous system and the cardiovascular system in order for them to work. Okay. They all work together. So functions of the skeletal system: supports the body, provides framework for the body, gives shape to the body, protects your vital organs, protects your tissues, provides calcium, provides phosphorus. Now, here's the important part, and also locomotion. Everybody's doing a brand. Okay, locomotion. But the other important thing is hematopoiesis. Can you say hematopoiesis? No, she can. Hematopoiesis. Hematopoiesis is the production of red blood cells. It happens in red bone marrow of the long bones and the flat bones in adults. Okay? Red blood cells, white blood cells, and platelets are produced. Hematopoiesis, that is the process of producing red blood cells, white blood cells, and platelets. Now, children like Sophia here have mostly red bone marrow in all their bones. But by the time they reach adulthood, more than half of that bone marrow becomes yellow. And hematopoiesis doesn't occur in yellow bone marrow. So remember, in adults, hematopoiesis occurs in long bones and flat bones in the red bone marrow. Get it? Got it? Good. Okay. Structure and function, the skeletal system, we already talked about what it does. Bones and cartilage are what's in the skeletal system. And the articular system are your joints and your ligaments that help you move, right? Functions of the skeleton, we already said that. Support, protection, movement, hematopoiesis, and storage. Storage of what? Calcium and phosphorus. Okay? Here's the bones of the head. Parietal, occipital, frontal, and temporal. Okay? They're the bones of the head. Bones of the face. Really, what I want you to know is the mandible and the maxilla. Okay? The mandible's the jawbone. Go like this. That's the mandible. And the maxilla is this part, this bone. There's actually two maxillae, and that's how it's pronounced, maxillae. Okay. Now, spinal deformities. Look at these people. What's wrong with them? Tell us, Sophia. Lordosis. Can you say lordosis? Okay, she can. But anyway, lordosis is the duck butt. Kyphosis is the hunchback of Notre Dame, right? And scoliosis is the lateral curvature of the spine, okay? Where the spine, when you're looking at someone from behind, the spine curves, okay? There's the skeleton. He looks happy. He's doing a dance, okay? You don't need to know every single bone, but you need to know the femur, which is the thigh bone. You need to know the patella, which is your kneecap, the fibula, and the tibia, which are the two bones of the lower leg. You should know that your toes are tarsals, okay? And you should know that in your hand, they're carpals. The radius and ulna are the bones of the lower part of the upper extremity. And the humerus, because it's the funny bone, get it? Humerus, funny, is the upper arm. Excuse me. You should know the sternum, which is the breastplate right in the middle of your chest. You should know the scapula, which some people call the wing bone back here, and the clavicle, which is also known as the collarbone right there. Okay? And the ilium right there, iliac crest, that's the hip bone you can feel. And then the pelvis and the sacrum. Okay, there you go, guys, right? The adult human body is 206 bones. Newborn is about 300. Why? Newborn's got bones that aren't fused yet. They fuse together later on. Okay? So, what's the structure of bones? Compact bone is hard, dense, forms a shaft in the outer layers. Spongy bone like bony plates in your body. They have more spaces inside. That's what makes them spongy. And the medullary cavity is the hollow inner part of most bones, and that's where the marrow is. Medullary cavity. Marrow, you have yellow marrow and you have red marrow. Okay. So the yellow marrow is in the medullary cavity. The round marrow is in the ends of long bones and in the bodies of vertebrae and flat bones. And that's where hematopoiesis takes place. Okay. Manufactures red blood cells, white blood cells, and platelets. There are bones. Okay. When you look at a long bone, for example, say a femur, the diaphysis is the middle part, the longest part of the bone, with the epiphysis on either end, proximal epiphysis and distal epiphysis. And then bones of the pelvic girdle, okay? Like I said earlier, this is the ilium, the iliac crest. That's the hip bone that you can feel, right, in the front of you, okay? The head and neck of the femur articulate into the ischial, the ilium and the ischium, and that's the hip, okay? Joints. So there's three types of joints. There's synarthroses, amphiarthroses, and diarthroses. What do I want you to know? Well, diarthroses are synovial joints, okay? They're the ones that we really need to talk about because they're like the elbow is a hinge joint, ball and socket, shoulder and hip, pivot joints, gliding joints, condyloid joints, and saddle joints. Make sure you know the hinge, the ball and socket, and yeah, those are the ones I want you to know. Okay. And there's an example of a hinge joint, the knee, right? It only goes okay. And ball and socket joint, like I said, hip, shoulder. They have the biggest and most wide range of motion are the ball and socket joints. Okay. Pivot joints, your hands. Think about it. If I hold my hand out, I can do this. Rotate. That's called supination. Okay. Supination. Make sure you know that word. Supination. Okay. 1 second, baby. We got to finish teaching. Okay. There are condyloid joints. Don't worry so much about that right now. But do know the divisions of the skeleton. Know that the axial skeleton is your skull and your vertebral column, basically your thorax. That's the middle, right? The axial skeleton. The appendicular skeleton are your limbs, your upper and lower limbs, pelvic girdle, and then your shoulder girdles up in here, pectoral, right? What's in the middle of the torso is the base. That's the axial skeleton and the skull. All right. There's a breakdown again of the divisions. The axial, right? That's the axial. See how that's kind of in the middle? That's the core. And then the appendicular is everything else. Okay. There's pictures of the different joints. Saddle joints, don't worry about that. You should know cartilage. Okay. Cartilage is kind of like bone, except it's softer and flexible, right? There's articular cartilage, fibrous cartilage, and elastic cartilage. What does it do? It helps reduce friction and it also absorbs shock, right? So we'll talk about that in a minute. Articular, absorbs shock and reduces friction. Okay. The elbow is an example of which type of joint. If you said hinge, you'd have been right? The hinge. Here's the skull, okay? I don't expect you to know all of these suture lines, so do not worry about that, all right? Fontanelles, we'll go through that when we get to maternal newborn. The vertebral column, let me tell you something fun that you should know. You should know that if you remember when you eat breakfast, lunch, and dinner, you're going to remember how many cervical, thoracic, and lumbar vertebrae there are, okay? That's the way to know. So let me highlight this, okay? So you eat breakfast at 7 a.m., there's 7 cervical vertebrae. You eat lunch at noon, there's 12 thoracic vertebrae. And you eat dinner at 5 p.m., there are 5 lumbar vertebrae. Breakfast, lunch, and dinner. That's the way to remember it, okay? And then when we look at each of the vertebrae, This is kind of a breakdown. You've got the vertebrae, and then you've got what's the disc, right? You've heard somebody say, I herniated a disc or I have a slipped disc. It's the little shock absorber or cushion in between the two bones. If that moves out because of injury, then it's bone on bone and it pushes on the nerves that emanate from the spine, and it can be very painful. Okay. There's your thoracic or rib cage, protects the organs like the lungs and the heart. Okay. There's your hand, right? Again, there's the ulna and the radius. You don't need to know all of these bones, but you do need to know that the bones that start making up the hand and the fingers are the metacarpals and carpals. Okay. In the toes and feet, they're the tarsals and metatarsals. There's lower extremity. Okay. So you see the femur here articulates with the tibia and fibula down here, and your knee is in between. Okay. There are your tarsals, metatarsals, and phalanges are the very tips of your toes and fingers. The pelvic girdle, that's where it supports your spinal column, protects parts of your digestive system like your intestines, etc. Okay. Formation of bones. You need to know that an osteoblast, they're cells that build bone. Osteoblasts are bone building cells. And I do believe that that's the end of this revised musculoskeletal, really bones, 18-1. So I hope you enjoyed it. And I hope that clarified the hematopoiesis part of it that you definitely need to know forever and ever and ever. Okay. Bye.